Hello, I am Jennifer Kleinberg. I am a psychiatric mental health nurse practitioner student at Franklin University, and this assignment is for Advanced Pathophysiology. In this assignment, we're going to explore hypertension and the role of the master's prepared nurse in this situation. My patient is Devin Jones with a history of hypertension, and I am now going to speak to Mr. Jones about his pathophysiology of primary, secondary, and complicated hypertension, and things that I would explain to a patient. All right, so Mr. Jones, hypertension or high blood pressure in layman's terms happens when the force of your blood against your artery walls is too high. There are three types: primary, secondary, and complicated hypertension. This is the most common type, the primary, and develops over time due to factors like genetics, lifestyle, and aging. Your arteries become stiff or narrow, making your heart work harder to pump blood. Secondary hypertension, this type has a specific cause like kidney disease or hormonal imbalance. Once the underlying issue is treated, the blood pressure may improve. Complicated hypertension, this occurs when high blood pressure is uncontrolled for a long time and damages organs like the heart, brain, kidneys, and eyes. So the clinical significance of your history and symptoms. So your history is concerning because hypertension runs in your family, increasing your risk. Your weight gain, alcohol intake, and poor diet contribute to high blood pressure. The shortness of breath you experience with activity could be a sign that your heart is working too hard due to that strain from the high blood pressure. It's very important to make lifestyle changes. So, potential complication of hypertension. If your blood pressure remains uncontrolled, your heart has to work much harder to pump blood, which can lead to a lot of different things. One of those things could be heart failure. This is where your heart becomes too weak to supply blood with enough. This is when your heart becomes too weak to supply your body with enough blood and oxygen. Over time, high blood pressure can thicken your heart muscle, reducing its ability to pump efficiently, which leads to fatigue, swelling, and even heart attacks. Not fun. So how can you improve your health, Mr. Jones? To prevent complications, you can modify your diet by reducing sodium, saturated fats, and processed foods. Eat more vegetables, fruits, and lean proteins. Limit alcohol. This can raise blood pressure. Reducing your alcohol intake can improve your heart health. Exercise regularly. Even 30 minutes of walking 5 days a week can lower blood pressure. You want to monitor your blood pressures and take them regularly, just to make sure they're in a safe range and you know what's going on with your body. Also, consider medication with your provider. If lifestyle changes aren't enough, your provider may recommend medication to control your blood pressure. So making these changes will significantly reduce your risk of complications and improve your overall health and quality of life. So let's work together to keep your blood pressure under control. Yes? Okay. Thank you so much. Bye-bye.